Just because you don't feel sick doesn't mean you shouldn't see your doctor. Preventive care can help you find out about health problems early and get the treatment you need. It can help you change your lifestyle to improve your health and keep you from becoming sick in the first place. At Blue Cross and Blue Shield of Vermont, we want you to get preventive care, so most of our plans deliver preventive care benefits at no cost to you. If you do have a copayment for preventive care, it will likely be modest. All of the plans we offer on Vermont Health Connect feature preventive care with no cost sharing at all. Preventive care includes certain screenings, tests, medicines, and counseling performed or prescribed by your doctor or other healthcare providers when you don't have signs or symptoms of an injury or illness. Your provider also may deliver care to prevent you from getting sick. We encourage you to get appropriate preventive care for your age and gender. A good way to get such care is to schedule a well visit, also known as an annual physical, with your primary care physician. Some preventive care is appropriate for everyone, men, women, and children. For example, everyone should have their height and weight checked, and most people should have a flu shot. But men, women, and children need different types of preventive care as well. Women need pap smears, for example, and children need more immunizations than their parents. We also need different preventive care as we age. Women need mammograms after age 40, and adults need colonoscopies at age 50. Appropriate preventive care is almost always covered and usually requires no cost sharing, as long as the United States Preventive Services Task Force considers it appropriate for your gender and age. You can find detailed information about preventive care at BCBSVT.com. It's important to know the difference between preventive and diagnostic medicine. A preventive procedure starts with the intent of confirming your good health when you are apparently free of symptoms or disease. Diagnostic medicine happens when you go to your doctor or other healthcare provider with symptoms and your provider recommends screenings and tests to diagnose their cause. While we cover diagnostic services, you may have to pay deductibles, co-payments, and/or co-insurance, even if your plan covers preventive care at 100%. Preventive care can turn into diagnostic medicine. Sometimes a provider begins a preventive screening or test, and during its course, finds or suspects disease. The provider then bills us for a diagnostic procedure. You may have to share in the cost. Also, if you have a history of a particular illness, a screening related to that illness might be considered diagnostic for you, while it may be preventive for other patients. Check out these examples. Scenario 1. A 30-year-old woman without symptoms has an annual physical. It includes a breast exam, a pap smear, cholesterol and glucose screening, and screening for sexually transmitted diseases. The pap smear shows an irregularity. The annual physical will be paid at the preventive level. A follow-up exam done at a later date because of the irregularity of the pap will be paid subject to cost sharing. Scenario 2. You have a lipid test and a metabolic test at your annual physical. You don't have to pay cost sharing for the lipid test, but since the metabolic test does not appear on the USPSTF's list of A and B rated services, you must share in the cost of the metabolic test. You may need to pay co-payments or deductible and co-insurance. You may need preventive services because of your individual healthcare needs. The USPSTF bases its recommendations on the needs of the general population. You may have special needs, so we encourage you to consult your doctor or other healthcare provider about additional preventive care.
Blue Cross and Blue Shield of Vermont. We'll see you through.